And joining us now on the phone is infectious diseases expert Dr. Rontgene Solante. He's also a member of the vaccine expert panel. Good morning, Dr. Solante. Thank you so much for taking our call. Now, as you know, the entire country is now down to moderate risk for COVID-19, and Metro Manila and other provinces are back to alert level 2. And we've been seeing a downward trend in cases. But is this the right time to ease protocols? Because even though there has been a downward trend, numbers are still pretty high compared to the last time we were at alert level 2.
Yes, correct, Ria. No? This is a good sign that for the past week, our cases are going down, the reproduction number are going down. Definitely, this is something that we aim for, especially for healthcare workers and doctors, and also to open up the economy. But I think it's still too premature, very premature to say that we are already off the hook. And I totally believe the alert level will still be very important because that gives us a leverage in terms of preparing particular area wherein there will still be what we call community transmission.
All right. Now, another way that the government is easing restrictions is by doing away with the facility-based quarantine for inbound travelers. What are your thoughts around this, as many people are concerned? Because as we know, the virus has a certain incubation period, and we've seen many instances of people leaving their country of origin with a negative RT-PCR test, but after they come back, after a few days, they test positive.
Well, there's an important rider in that particular implementation, and that is they should be fully vaccinated. As much as possible, they should also have the booster dose. And the other part there is that there should be monitoring, because it doesn't mean that they will be lifted in terms of the quarantine, but they still have to stay at home and quarantine at home.
But, Doctor, how feasible is that? Given the fact that we've seen many people violating their quarantine?
Well, the other safeguard there is that when they will be vaccinated, we know that when you have the vaccine, when you have the booster dose, the number of the virus, the viral load are lower compared to those who are not vaccinated. And if they will be carrying the virus, the risk of transmitting that to other people may also be lower, especially if they will be going home to a family also of vaccinated individuals. So I think for me that's fine, and as long as there's that rider, that as long as they are fully vaccinated.
Right, and ideally they go home to a family that is also fully vaccinated. Now, Doctor, yesterday we logged in over 7,000 cases. Moving forward, what can be done to prevent another surge such as what we saw last month? Because the fact is we cannot predict if there will be new variants and, what the characteristics of those new variants might be like.
Well, I think we always repeated this one, that vaccination will be the important factor if we really have to control the transmission, the mutations, these possible mutations of the variants. And I truly believe vaccination will be very important, not only in controlling the infection, but also stopping the transmission. And more or less, if we are boosted, if a lot of us will be boosted also, and that would be very much, we will be able to control the transmission.
All right, Doctor, I want to talk about pediatric vaccinations, or the inoculation of kids aged 5 to 11 years old specifically. That's going to start tomorrow. How prepared are we for this?
Yes, I think the Department of Health has really prepared for this, and I've been attending several town halls with information dissemination to the vaccination centers in different parts of the country, preparing the healthcare workers on how to explain to the mother the importance of vaccination and why should they submit their children for this COVID vaccine, because we know children, especially Ria, the 5 to 11 years old, are also the vulnerable population, as vulnerable as that with the 60 years old and above. And we don't want this population to be left out in terms of the wall of immunity that we want to build in order to lessen the transmission of the infection.
All right, thank you for that. That was Dr. Rontgene Solante joining us this morning.